Hello everyone, Namaste. I will just share a few important updates regarding hypertension. So, as we all know, as per WHO, about 63% of total deaths in India are due to non-communicable diseases, which includes hypertension and cardiovascular diseases. And about 45% of these people belong to young to middle-aged group, that is 40 to 69 years of age group. And in India, especially, the prevalence has increased also in the lower subgroup, that is 30 years to 40 years of age group patients. And the International Society of Hypertension has released the latest guidelines for hypertension control. Also, the ACC AHA has released these guidelines. So, as per these guidelines, blood pressure control is most important because we have seen that it is poorly controlled among majority of the classes, mainly because of low awareness about hypertension, lack of appropriate care, and a poor follow-up. So the guidelines suggest that blood pressure should be less than 140 millimeters of mercury systolic and less than 90 millimeters of mercury diastolic. This should be your ideal target blood pressure. And we should categorize the patients into two groups. That is, one, those who are having no risk factors. And what are these risk factors? Risk factors are basically smoking, then obesity, dyslipidemia, diabetes, hypertension, any prior history of coronary artery disease or stroke or renal dysfunction, and also those who are having hypertension mediated end organ damage, like for example LVH on ECG, or who is having evidences of stroke, or who is having peripheral arterial disease or atherosclerotic renal artery disease. So these are the broadly, if we see in routine day-to-day practice, these are the risk factors which we should consider in our patients. And then those who are having any one of these risk factors, we should prioritize these patients for a good blood pressure target control of less than 140/90. And along with this, lifestyle modifications plays a very important role. Like for those patients who are not having any risk factor but still having a blood pressure above 140/90, then we can consider to start lifestyle modifications in these patients. Like for example, this includes exercise, that is 30 minutes brisk walk at least 5 times a week. Then dietary modifications like no added salt in diet. Then potassium rich foods or fruits should be considered in the diet. And most important is weight reduction and weight control. These measures, exercise, diet, and weight, play a very crucial role in the blood pressure control, and they supplement our drugs. So, this is the most important message which is important regarding the blood pressure control, that is, give focus to the patients on both lifestyle as well as the drugs. And now, coming to the categorization of the blood pressure, that is, it can be a mild hypertension, moderate, or severe. This depends on the systolic and diastolic values. Like if you broadly see, 140 to 159 will be mild, 160 to 179 systolic will be moderate, and more than 180 mmHg systolic will be a severe hypertension. And this severe hypertension can again be classified into either a accelerated hypertension, which is only a BP reading more than 180 by 110 millimeters of mercury, but no evidences of any organ dysfunction or any symptoms. And second is a malignant hypertension, where the patient not only has a very high BP, that is more than 180 by 110, but is also having evidences of some organ dysfunction or some symptoms, like having a very severe headache or blurring vision or having a heart failure symptoms or having a renal dysfunction. So for those patients who are having malignant hypertension, admission and IV medications are necessary. For those patients who are having accelerated hypertension, we can consider a oral medication and follow up the BP readings every hourly. So these are the main thing regarding the emergencies of hypertension, which also we should consider in these groups of patients. And lastly, also want to suggest some investigations or what needs to be tackled. That is, one needs to also rule out a secondary hypertension as a cause for this hypertension, in especially in young patients or in those where we are not suspecting a hereditary or a familial hypertension as the cause. Like the secondary hypertension one should look for is renal dysfunction, then hyperaldosteronism, then sodium potassium values, then renal creatinine values, then also rule out a coarctation of aorta by doing a basic echocardiogram, also rule out obstructive sleep apnea and thyroid related disorders. So this is the in crux, in short, about the hypertension and all related conditions. Thank you all for your patient hearing. Thank you.